So when I was first diagnosed with schizophrenia, the most important thing was this commitment to continue taking these medications. And also, it was important for me to find the right medication that would really give me back my life. But there were other things that were important too. One of them was drug and alcohol use. It's extremely important in anyone really, but especially with people at a risk of having schizophrenia, to avoid alcohol and drug use.
So when you were early in your illness and you would see the psychiatrist as an outpatient, how would they wrap up? I mean, what advice would they give you?
The biggest advice really was do not give up and keep taking this medication. If you have trouble with the medication, if you have side effects, call the doctor. But as I continued to see these doctors more, they were also interested in helping me build healthy habits for life and brain health, really. Not to be pulling all-nighters, to have a healthy social life, to interact with parents and friends. For me, going to church was pivotal in my life.
So, this is a really important area. So with patients that have severe mental illness, whether it's schizophrenia or something similar, there's really three things they got to do.
Okay.
They got to go to all their doctor's appointments. They got to take all their meds as they're prescribed, and they got to avoid drugs and alcohol. If patients do those three things, we as a field, as psychiatrists, can do a pretty good job of keeping them alive, keeping them out of the hospital, and keeping them functioning at a pretty high level. But if even one of those three things, you don't go to your doctor's appointments, you don't take your meds, or you're using drugs and alcohol, even if you're going to the doctor, even one of those three things isn't in place, it's not going to go well. And so often I find myself emphasizing those three things, and they sound simple. But if you think about it, and you might have something to say about this, it's hard to decide to wake up every day and take a pill.
Yeah. Especially when the pill has side effects.
Yeah.
It can be discouraging, and you can feel like you just want to stop the medication or stop trying trials of medications. But the important thing to know is that this is worth it. When you keep going to see your doctor, when you refrain from drug and alcohol use, when you have healthy habits, it can change your life. It can bring you to a point of recovery. So even if it's a lot of work, you just have to not give up. You have to keep going. And you have to believe that it's going to be worth it.
So the other thing that comes up is, this idea that you're going to the doctor, you're taking your meds, you're not using drugs and alcohol. But to be able to do that, the patient really has to take responsibility for the illness.
Yeah.
They have to own it. It has to be their baby. If you go into this thinking, oh, this isn't, I'm not the one that has to make sure I take my pills, or I'm not the one that has to make sure I get to my appointments, or I'm not the one that has to take care of my brain, whatever that means.
Sure.
If the patient doesn't take ownership of being sick, it's not going to work, because they have to do it for themselves.
Yes.
And there was a point where you weren't doing it for yourself, or you weren't doing that, and then you kind of figured it out. Can you talk about that?
It was my second hospitalization. The first hospitalization, didn't believe I had it, went home, went off the med. But I remember during my second hospitalization, the psychiatrist actually sat down with me and he said, look, you've studied biology before. Schizophrenia is a brain disease. It's a treatable brain disease. And he explained to me that these medications are not just sedatives. These medications restore the healthy chemical balance in your brain so that your brain heals itself, your symptoms go away, and then you can go back to the things that you love in life. For me, that was studying biology again, playing the violin, having healthy relationships. So I didn't buy into this until my second hospitalization. But once I did buy into it, I was ready to get better. I was ready to move on.
So what do you think the cost was between your first and second hospitalization personally for having that sort of delayed sort of embracing of the process? Did anything bad happen in between those hospitalizations?
Well, after I went off my medication the first time, I became very psychotic. The voices were coming back. And at that point, I actually broke a violin because the voices told me to. And it was on that day that I went back to the hospital. I had I had never broken something valuable to me in my entire life. This was very very much not me.
You basically made it into kindling, right? If I remember the story, you broke it into lots of pieces.
Yeah,
Yeah. And that's
my parents still have the pieces, but
that's pretty scary that you went from being in the hospital, treated on a medicine, stopped taking it, got sick, and then in some ways you were even worse. You did something you'd never done before.
right.
And that sort of psychotic impulsivity is really dangerous from the standpoint of suicide. And so one of the things we worry about in untreated patients or patients who aren't coming to their appointments is safety.
Yeah.
Primarily safety to them, but also safety in their environment. And one of the things that's really sad about schizophrenia is there's a pretty high rate of suicide completion. And that's something we worry about and assess at every appointment. There's some myths about suicide, and one of the myths is asking somebody if they're suicidal is going to give them the idea to do it. It's completely a myth. It's okay to ask. And so I'm always talking to loved ones and wives and parents of patients and letting them know it's okay to check in on safety,
Right.
have a way to talk about it, and we may work it out right there in the office. And the same thing applies to hearing voices. It's very important that if someone starts hearing voices, that they tell somebody.
Right.
Even if they're on medication and going to their doctor's appointments, we need to hear about it.
For me, when I was diagnosed, the voices were very, very bad. But when the doctor asked me if I was hearing voices, I said no. I could not accept it. He saw the way that I was walking around the hospital, getting something to eat, throwing it away untouched, looking around, kind of hearing stimuli from, other parts of the room, and he knew that I was hearing voices. I was home.
He could tell just by looking at you.
He could. That's how severe they were.
And we call that responding to internal stimuli. It's like you hear someone calling your name and you turn your head to look to see if they're there.
Right.
It's hard to cover that up if there's really nobody there. And without even asking you, most psychiatrists can detect that symptom.
They can tell.
Yeah.
And even me, if I see someone in a hospital area hearing voices, I can tell from my own experience that, yes, that person's probably hearing voices.
So what stopped you from telling the psychiatrist? What got in the way?
Shame. Too embarrassed. I couldn't tell my psychiatrist, couldn't tell my parents. About 3-4 months went by.
What made it shameful?
The stigma. I didn't want to be crazy. I had a certain idea of what it meant to be a person who heard voices, and I couldn't become that person. I couldn't accept that was happening to me.
Well, let's talk about that a little bit. When did you first figure out what the word schizophrenia meant?
Probably in high school. It meant you were crazy, you were insane.
But what does it literally mean?
Schizophrenia literally means split mind. It's from the Greek. But I know today that schizophrenia was named in 1908 by a guy named Eugene Bleuler. And schizophrenia, the name itself, needs a makeover because schizophrenia is not split mind. Am I correct?
Yeah. So the metaphor of split mind, for most people, when they hear that, they think about somebody who has more than one personality.
Right.
And some of the time, they're this personality, and some of the time, they're this other personality. And that's not what schizophrenia is. People with schizophrenia have one personality. I assure you. You have one personality?
I do.
You do. And so it's a name that has stuck around, and unfortunately, when you break down what it means, it sort of gives this meaning that doesn't really hold up.
Yes, that's right. It also needs a new categorization. It's a brain disease. I don't know why we continue to call it a mental illness. We refer to Alzheimer's disease, Parkinson's disease as physical brain diseases, whereas schizophrenia is portrayed as different. And that's another reason why I could not accept that I was hearing voices, because that would mean I had a mental illness. And I saw myself as strong. I thought I could never, ever develop a mental illness.
So do they call schizophrenia something different in other countries?
Well, I've heard that in Japan, it's been renamed as social integration disorder fairly recently, and I've heard that once it was renamed, many people who had always said they did not have it were willing to accept that, yes, they did, or they might.
It kind of fits in with the stigma, shame piece that you were talking about.
Embarrassment.
So, right. So this idea that if you're feeling ashamed or embarrassed, you're not going to be able to disclose your symptoms to people that you love or trust or your doctor.
Right.
And reconceptualizing the illness, though even the way it's named, there's a lot in a name, sort of gives it a different take
Yes.
and makes it a little easier to talk about.